Hi everyone, let's talk about the infections people are getting from oysters. Vibrio bacteria are heavily concentrated inside oysters. In fact, Vibrio are the most common shellfish associated infections. You can get other infections like norovirus, but we're not going to talk about that one today. So why do you get it? Well, you get it from eating raw or undercooked shellfish, or having exposure to ocean water or brackish water, and that's water where lakes meet up with the ocean, usually via a river, and where those areas intersect, you will find more salt in the water and increased possibility of getting this Vibrio infection. Well, you can get a wound infection if you have an open wound that is exposed to this ocean water or the brackish water. You can even get an infection from handling the raw shellfish. You know, I saw one patient who had underlying liver disease. He went to the ocean, never swam in the ocean. He just walked on the beach, and he ended up with a really bad infection in his leg, pretty severe, just from walking on the beach, where he certainly encountered shellfish that got into his skin. So let's talk more about this infection, what it is, and stay tuned to the end, where I'm going to give you some good hints on how to prevent this infection and, well, how to avoid it. Overall, this is a rare infection. The most lethal species of Vibrio, however, is Vibrio vulnificans. If you get an infection from this particular organism, the mortality rate is about 20%. That means 1 in 5 people will likely die from the infection. So who's at risk? Well, anyone can get sick from vibriosis, but patients with underlying liver disease or alcoholism are at highest risk. Other patients that are at increased risk include immunocompromised patients, either from taking medications for cancer or other autoimmune illnesses, and patients with chronic diseases like diabetes, chronic kidney disease. If you have hemochromatosis, you're at an increased risk because these bacteria, they love iron, and hemochromatosis is an iron overload state. So what are the signs and symptoms? Well, usually you get sick within about 24 hours of exposure. Sometimes it can be up to 3 days. And it really kind of depends, the level of illness really depends on both how much bacteria you get, the inoculum, and also your underlying clinical state or immunologic state, or whether you have liver problems or alcohol. So you could have like a GI illness with just nausea, vomiting, diarrhea, and fever, or you could end up having a more severe illness with it throughout your body, and with fever, decreased blood pressure, and what we call sepsis. And folks can get just a plain wound infection from Vibrio, and that presents with really its bright red and blistering type lesions. You know, I once saw a patient that was just simply walking on the beach, didn't even get into the ocean, but he had underlying liver disease, and he had a pretty severe infection on his leg as a result of that exposure. So you can have just this leg infection with cellulitis and bullous type lesions, but it can get deeper into the skin, and you can end up with this thing called, what you might have heard about in the media, flesh-eating bacteria infection. And that's what we call necrotizing fasciitis, but what it tells you is there's tissue destruction, and it really is a deeper infection and a surgical emergency. Now, if you like this video, please press the like button and subscribe. It really helps my channel to grow. So how can you avoid the Vibrio infection? Well, first of all, don't eat raw or undercooked shellfish or oysters. And discard any shellfish that's already open before you cook them. And make sure you wash your hands with soap and water during handling or after handling the raw shellfish. And remember, the juices are contaminated too. Treat it like you're handling raw chicken. Make sure you sanitize the area and don't cross-contaminate raw or uncooked oysters or shellfish with the cooked shellfish. Make sure you boil the shellfish for at least 3 to 5 minutes. And any shellfish that have not opened during the boiling process should be discarded. Or try to boil them further, but discard them if they do not open because they're not really clean inside. Or sterilized, quote, aseptic inside. And stay out of salty water if you have a wound. You know, cover your wound with some waterproof type dressing if you're going to need to go into the ocean or have it exposed. But try to avoid exposure. Even avoid exposure if you have a recent tattoo as well. Because there was a case of a guy that had underlying liver disease, had a tattoo, and went to the ocean, and he got it too. I'm sure there's many cases like that. So make sure you wash your hands with soap and water as well if you've been exposed to Now, if you do develop a skin infection, make sure you tell your provider that you've been to the ocean, or if you've had exposure to raw or uncooked shellfish or oysters, or even the potential of exposure. Now, if you're at a higher risk of getting an infection, like liver disease, alcoholism, immunosuppression, or some other chronic disease, you may want to consider wearing something like water shoes when you walk in the ocean or definitely on the beach. And also consider wearing some protective clothing when you're cooking any raw or handling raw oysters, such as gloves. Well, if you like this video, go ahead and take a look at my channel. I'm here to help educate patients on different infections. Have a great day.